While COVID-19 cases are going down in the country, the demand for Filipino health workers abroad continues. The Philippine Overseas Employment Administration says it is raising the deployment limit for medical workers. We now speak to POEA Deputy Administrator Bong Plan. Maraming salamat po for joining us on the final word, Mr. Plan. Bakit po inaakyat ng gobyerno ang deployment cap for healthcare workers?
First of all, good evening, Sir Rico, and good evening to your viewers in the final word. And thank you also for giving us this opportunity to discuss the issues and concerns of our OFWs and to give a bit of good news also on employment abroad. Anyway, with regards to your question, we have raised the deployment cap for this year because, of course, first of all, we have a lower COVID cases right now, and also the PRC have conducted several licensure exams for nurses, and because of this, we are able to replace those nurses that we have right now with the new licensed nurses. Also, there has been a clamor coming from our healthcare workers, particularly from our nurses, to give them an opportunity to work abroad and to have a better compensation for their work.
So, Sir Bong, how many nurses and doctors are scheduled to leave within the month and next month?
Well, sir, actually, this we do our deployments are really demand driven and is dependent on the different health protocols and quarantine protocols imposed by the different countries. So we don't have a particular number that we could give, but last year we have deployed more or less about 10,000 healthcare workers, and if you divide that by the month, it would be about 900 to 1,000 healthcare workers.
So Sir Bong, ngayong inaakyat na ngayon, no, yung deployment cap, ano po mga bansa need our healthcare professionals?
Well, actually, the need for healthcare professionals is global. So everyone needs our healthcare professionals. But let me give you some, let me name some of the countries that we have deployed. For example, we have the USA, we have the United Kingdom, Germany, Saudi Arabia, Japan, and Australia. So these are the countries that we have been deploying healthcare workers, particularly nurses.
So, Sir Bong, with the increase in the deployment cap and also our healthcare professionals seeking an increase as well, hindi po ba maapektuhan our own medical manpower given that we are still in a pandemic?
Yes, Rico, that's a very good question. There is an interagency group that continuously assesses the supply and demand of our healthcare workers, both for the local healthcare system and overseas employment. Lagi po nating tinitignan at binabalanse yung mga interest po ng, of course, the right of our workers to work abroad, as well as our interest to protect our healthcare system. So we continuously, there's a group that continuously assesses this the supply and demand of our healthcare workers.
Of course, no, Sir Bong, no, the deployment of our healthcare workers, of our kababayans overseas really helps our what you call overseas remittances. Nakita po natin, over $30 billion in 2021, surpassing by more than 5% the 2020 level of overseas remittances. At nakakatulong po ito sa ating ekonomiya. But how are you ensuring the safety of our kababayans, especially still in the midst of this pandemic when they're deployed overseas?
For agency-deployed OFWs, there is a system called OFW monitoring system in the POEA, where agencies are made to regularly report on the situation of our OFWs that they have sent abroad. So this is one. Then we are now pilot testing an app wherein our balik manggagawa or returning workers, direct hires, and those deployed under our government-to-government arrangement, we do have a pilot testing for an app wherein we could regularly monitor them.
All right, that's very good news, no? That our kababayans can be tracked wherever they are in the world. Pero ngayon na we're seeing easing restrictions worldwide in Western countries and in other Asian countries, apart from the healthcare sector, which other sectors, Sir Bong, is there demand for Filipino workers in other countries?
Well, actually, there are a lot. Aside from our healthcare workers, particularly nurses, the demand for our seafarers have been quite high. In fact, for 2021, it's the seafaring industry that have immediately recovered from the downside of this pandemic. Also, we have for engineering and engineering professions. There's a big demand also for that. We do have demand also in the hospitality sector, considering the fact that tourism and other businesses are already opening up. Of course, the service sector, it's also opening up right now.
So much demand for Filipino talent overseas, but are there still some countries, on the other hand, Sir Bong, that are still banning the entry of Filipino workers?
Actually, there's no country that bans Filipinos, but there are travel restrictions that are being imposed right now because of health and safety protocols. Like, for example, Hong Kong right now and Japan. There are still travel restrictions to that country. But I heard from our Japanese counterparts that they will be opening up travel restrictions maybe on this coming month.
Well, thank you so much for sharing the plans of the POEA, Deputy Administrator Bong Plan.